Welcome to Backstabbers, the only podcast where we're not just sticking needles in your back, we're talking behind it too. All right, Super Bowl Sunday. Oh, I hear nothing.
The Chiefs were clearly. We forced Alex.
I was going to say, I am 100% a bandwagon fan. But here we are supporting.
We're supporting it. That way we all match.
I will say I'm probably a little bit of a bandwagon fan too, because I grew up in a different state. And the state, we don't have a team in my state. And most people cheer for the Cowboys where I'm from. And the Cowboys have not won since I was a small child. So
that's what I am plagued with.
I was easy to jump.
Well, it
Hop
depends
right on.
because Johnny is the same. He's the Cowboys fan.
Why is everybody default Cowboy fans?
It's America's team.
Yeah,
I guess it is. I will say I've been
of the 90s.
It was fun. It was a good time. But you can't really have a bad game at a professional football game, in my opinion.
Well, you also had amazing tickets.
That is also true. And I was there to watch the Razorbacks.
Yes.
Originally, which is my home team.
Yeah.
We're so much of Cowboys fans that our second child is named after Tony Romo's son's name.
So, I didn't know that's where the name came from.
Yep. His son's name's Hawkins. And we also have a Hawkins.
I just thought it was kind of a play on hockey because y'all love hockey.
It's a happy coincidence, if you will.
That's funny.
I didn't know that either.
Yep.
Look, learning stuff about ourselves on.
But I do remember the moment when the boys were nicknaming each other or shortening their names because we call Easton E. And I remember the moment that Easton was like, hockey, hockey.
We should say we're Super Bowl partying it up as we speak. So there's a high likelihood one of our spouses or children will come busting in. That would be a fun bet. Forget the Super Bowl bets. Whose family is going to interrupt?
Baby crying. I just want to warn them. I don't know what's going on out there, but
it could be one of our husbands.
It also could be. I can picture both of them doing that at the door just to mess with us. It's not hard.
No.
But my voice is back. I know everybody's sad except for me. But anyways, so let's jump right in.
Let's do it.
Y'all want to start out with, hey, anesthesia?
Sure.
Anesthesia questions that everybody needs to know.
We'll do it. I think one that keeps coming up and one that's been emailed in at least is, does it really matter if I eat before my surgery or drink? Why is it important to be NPO?
Yes, it matters.
It does matter. And I know everybody thinks that we're just mean, and it doesn't really matter. They'll never know if I drink a chocolate milkshake before I come in for my procedure.
It's a lie. We will know.
I know.
We'll know.
Yeah. The only people who care if you've eaten are your mother and anesthesia.
That's it.
That's it.
No one else cares.
And let's be clear, we're not going to feed you. Your mom might. We are not. We want to make sure you have not eaten.
And the only reason your surgeon cares is because we care.
That's also true.
But don't lie to us. Please don't lie to us.
Because you throw it up in my face, and our relationship takes a bad turn when that happens. I get bitter pretty quick.
So ironically, this week I had a robot case, and the guy had kind of a fuller beard, and so it was with a student, and he was like, I think let's just go ahead and like pseudo RSI. Masking's not going to be easy. And I was like, I like that train of thought. Let's do it.
I'm going to stop you. Tell them what RSI means.
Oh, yes. So rapid sequence intubation. So we give you a paralytic muscle relaxant that works that much quicker. So we have two options. We can do one where you help the person breathe while you're waiting on it to kick in, or we give one where it's so quick we don't have to. And so we had gone with the quicker of the two and did not have to what we call bag mass ventilate and help you breathe while we're waiting on this relaxant to kick in because, breathing's important. And so thankfully we had not done this. And so we stick the ET tube in, all is good, because it's a robot and we're going to be in some different positions and, they're in your belly doing things. We had dropped what we call an OG tube, which is just kind of like a big fancy straw that goes down into your stomach. And we were going to suck out any air, any extra juices, whatever that could be in there. 250 cc's of what looked like a chocolate milkshake came out of this man's stomach. No known history of diabetes, of gastric paresis, meaning your stomach's slower to empty, was not on any of like the GLP-1s, like the Ozempics, that would cause some of that. There was no sign. The only reason that we lucked out is because he had this beard, and my student was like, I don't want to mess with it. And I was like, I like the way you think. Let's not. But if we have helped you breathe while we were waiting on a longer paralytic to kick in, it could have come right back up and into your lungs, and you would have had a very nasty aspiration pneumonia. One of our providers always told the story about having a young guy, I think it was, who went to the ICU for like a week or two from a similar situation. Someone had eaten and not told the truth, and they aspirated up their breakfast burrito and stayed in the unit on the vent for a couple of days.
I mean, you think about all that stuff that you would never want in your lungs down there festering, and it gets deep into the lobes and in your and creates a pneumonia, and you can get really sick even if you're young and healthy. And when we push air and help you breathe, it puts air into your stomach and pushes that food out, which is why we don't do that when we know that you have a full stomach. So people that come in for traumas or bad accidents and we have to tube you regardless if you've eaten or not, those are the RSIs. We put a little pressure on your neck and we give those fast acting paralytics so that we can put the tube down as quickly as possible and protect your airway from anything. And then we can get all that stuff out your stomach.
It's more fine when we have a plan, though, going into it.
Yeah.
So we know, yes, to move quick and get that tube in and don't even give that opportunity. So then when you lie to us and we're not quite as prepared because you lied, then it makes it way more difficult and a serious risk for you.
Mm-hmm.
Yeah. So I've had it too with kids. Those are the ones that bother me the most because mom didn't want, or dad, whoever, didn't want to hear them cry. And so they let them drink something or eat something. And I get it. Kids, when they're hungry, are cranky. Totally understand. But I just don't think most people understand what a safety issue it actually is.
Because nobody wants to put their kid at risk.
No.
But I definitely have had that with tonsils before.
Yeah. Like that's a whole breakfast burrito in there.
I could pick out the McDonald's order that they had on the way in. And it's not appreciated.
But we just like to know our challenges beforehand.
Yes, it's just more
fun for us. It's all about being prepared.
Mm-hmm. Yeah.
Okay, so back to MPO and why anesthesia and your mother care if you ate, although two different spectrums. We want you to have not. She wants you to have.
Also true.
I want you to have never eaten. It makes my life easier.
So much easier.
So we were talking about with GLP-1s and the Ozempic type medications being huge with everyone. And I think one of the biggest problems with those, in my opinion, is that people are getting them from beauty clinics and random online things. And although I'm not saying everybody doesn't educate, but there is a large portion of people that do not get educated as much on these drugs, and they don't know the importance of telling us their last dosage, how often they take it. And then when we ask, they don't, or they forget to tell us completely, because if you've been on an injection and haven't been off of it a week, whatever you ate 2 days ago is probably still sitting in your stomach. Your stomach doesn't empty like it's supposed to, which is why you stay full for so long. So that is one of the reasons it's so important to us.
And I don't think there's as much of a stigma as there was, but I do feel like there's still a little bit of a stigma issue. I feel like now everyone's like, oh yeah, I'm on it. Yeah. But there is still a little bit of the you don't want to admit it, because we've actually had people we know come in and whisper to me like, I don't want it on my record, but I am on it and I knew not to take it within 7 days. And I'm like, as long as I don't care, as long as you're telling me the truth and it's been the 7 days, then I'm happy to still proceed as planned.
We're not the police. We
no,
will
don't
not
care.
Report. We don't care. That's like
I just don't want you to puke in my face.
Exactly.
That's really all it comes down to.
It's really about me. I don't want this to be any more work. That's why I tell the students all the time. I'm like, it's really about me and making my life easy. As long as I know to prepare for XYZ, then it's
we'll
fine.
Be okay. Well, and that's what. So I was saying, I actually read an article recently, and they were talking about scanning everybody's belly just to see whether you are or aren't on a GLP-1. And I think that's fascinating because you are in different phases of different emptying,
Mhm.
and everybody's different baseline anyways, but then add those meds to it or not, it's still an interesting fact. But they were saying they're finding, full bellies when you expect them not to be, and
Oh, I bet.
with no reason or no cause.
I will say we have a unique population, and I shouldn't say just us, but in this geographical area especially, um, people that don't go to the doctor as much. So on paper, they look a lot healthier than when they present to you.
Mhm.
And so you look at them, we're like, well, yeah, you don't have type 2 diabetes on your chart, but you probably got it. You don't have sleep apnea on your chart, but you probably got, you know what I'm saying? So I think we do get a large population that meets that criteria
I agree.
that probably, could stand a little bit longer of an MPO because there probably is some baseline delayed emptying of your stomach that wouldn't have picked up just by looking at your chart.
I agree. And Lacey and I were just talking about how we had scanned, it's probably been a couple years ago, but we were interested and we scanned somebody that had eaten, somebody that had not eaten that day, and then somebody that had just drank some fluids. And you could tell the difference. I mean,
Oh,
the
yeah.
fluids as you were scanning were just sloshing. You could see them sloshing.
Yeah, because I can't remember if we had been to a conference or if we had read something,
Yeah.
but we do a lot of ultrasound guided regional things. And so we're pretty knowledgeable with an ultrasound, but we had never scanned stomachs. We're like, well, let's just see, let's do our own little experiment. And it was real easy to see the difference
See, and
between the three.
that's another thing, kind of like what we were talking about epidurals, like in quick responses versus, doing a blood patch immediately, or you know what I mean?
Mhm.
So this would be a quick, easy,
Oh, yeah.
no
Nice,
cost
quick, yeah.
alternative. Like we can
I wanna
scan
say
your
you
belly
just
real
turned
quick.
them on their side and scanned
That's what we did.
kinda
We
right,
just
isn't that how
tilted
we
them
did it?
up.
I would lose the bet. We
You
talked
would.
about a bet and whose child would interrupt, and it's going to be mine. But your dots are beautiful. Show them to the listeners and then please leave.
She
This
did
is
them all by
this is
herself
my oldest, my mini.
on multiple levels.
Although okay, I love you. You have on the full chief skier. I'm here for it. Please leave. Love you.
girl.
Mean it.
Love you, long time. Love you, mean it.
That makes more sense.
See, I would have put money on him. That's what I would have put money on.
We need to put a lock on that door for sure.
We're gonna padlock that one.
Oh,
Oh, but yeah, so that is why we care so much and things that are important to us. And I do agree that the ultrasound would be a quick little additive to the pre-op assessment that might help us all out a little bit more and
Yeah.
just be a little bit safer.
I don't know if it's needed for everyone, but anyone that you're like, I
don't
question
quite
you.
trust you.
Right. Which would actually be
just
probably
as a bridge, that goes
90%.
for meth too. Okay,
Oh.
I don't care if you do meth, but just if you let me
Just
know,
tell me.
that'd
I
be
would
great.
like to know.
I don't judge you.
I don't, and I'm not going to report you. I'm not going to tell the
I
police.
might judge you a little bit, but I
Well,
won't report you to
I
the police.
won't.
That's what I'm
We have no insider trading
No.
with law enforcement. Okay,
Mm-mm.
we don't
If it
care.
makes
Yeah.
you feel any better, I won't make fun of you to your face. But just tell me. Just tell
We
me.
just, again,
You sound like a good time.
we
I don't
are
know.
prepared we're more prepared if you just tell us and you're honest.
We'll do an episode on meth too, on why we need to know
Yeah.
about that. But
That's a good one. Yeah.
it is. There are reasons.
Yeah.
Even though surgeons don't believe there are reasons.
There are, in fact, reasons. Yeah. And it definitely depends on where you're at in that meth journey.
Yes.
But
Yes.
we'll get
What
there. Don't
meth
worry.
journey are you on? It actually sounds glorious when you present it like
Yeah, but
that.
it's
The
not.
meth journey.
Oh, that's funny. All right, we need a word of the week. Since we've all been talking about food, should our word of the week be
I think it should be
something food related?
Definitely, especially since it's Super Bowl Sunday.
Super Bowl Sunday.
I do.
I mean, we could also make it football related. Could go either way.
We could, but I kind of, you said something earlier and it made me want to stick with it.
What's that?
I think we should go with Big Mac.
Big Mac.
I like it. You eat hamburgers at the Super Bowl,
Okay.
and I want to hear people working it in.
I was going to say, how am I going to work in a Big Mac
See, I've got
to
it.
an epidural? I have an idea. It's a stretch. I'm about to think about it.
I've already got it.
I've got a craving for a number 9 like my shoe.
Hey. I might work in special sauce too,
I don't know.
because that's how people get pregnant is with a
Special
special
sauce.
sauce. So I'm
Oh my
excited.
goodness.
Big Mac it is.
All right.
Big Mac.
Send us your stories of how you use it. Remember,
Yeah.
we have the mentality of 13-year-old boys. Just keep that in mind
Yes.
when you're working it in.
Yeah.
Send it, and we can read them if you have a
Oh,
really
yeah.
good one.
We should read the read
So
the winner.
mhm.
Words are hard today.
Yeah.
We should read the winner
She hasn't even
from the
drank
week
anything
before.
yet.
No, I'm just drinking
Okay.
Coke. It's because I'm freezing.
That's
Now I'm thinking about Diet Coke from McDonald's.
I'm telling you.
You know, they have their own, like, proprietary something with the CO2, I think it is. Like, they're the only ones who can keep it cold or something.
Something.
It's
Not
some
extra
agreement
sugar,
with
No,
fake
Coke.
sugar.
no,
No.
no. It's what they keep it in. It's the only. They're the
Oh.
only
Yeah.
people that do it,
And
that's
that's
why it tastes so
It
good.
makes a
why
difference.
it has that
Yes.
burn.
Oh.
But you know what? I don't like their cups. I'm gonna say it. I don't
Oh
like them.
no, they need to go back to the styrofoam.
Their cups are terrible.
It's
Okay.
just sweats everywhere.
I
I
agree.
know
and
it's bad for
watered
the
down
environment, but I like a styrofoam cup.
Is the plastic cup any better?
Probably not.
It doesn't go away
Then
either.
we're drinking microplastics.
Health, environment. I mean, it's a battle.
It
Which
is.
one are we gonna go with today?
Yeah. Whatever suits us at that moment is what we're gonna go with.
Well,
Sarah,
I saw-
you were saying you read an article, I think it was, or did a CME about how eventually all things may be a Tiva.
I did. It was on the AANA journal, and it said, "Is Tiva the new normal anesthetic?" Which I know people have very differing opinions on Tivas. If I could, I would probably do a Tiva on everyone. It is more work,
Mhm.
but man, they wake up and they're like just right back to normal. They don't get sick. It's just
Lacey, you disagree?
yeah.
I'm seeing a shaking of the head.
Here's the thing. I don't mind a Tiva. I really don't. I know I talk a big talk at work, but I get very frustrated because I have PONV unless I have a scope patch. So post-operative nausea, vomiting.
Okay.
If I have anesthesia of any sort, because I'm a lightweight, and I don't get the little patch behind my ear, I will hurl my toenails up. But if I get the little patch behind my ear, which is
Reminder.
it's a good time. If I get the little patch behind my ear, I'm money. I can wear it all the way until I get home, and then once I'm home, I take it off. Not once puking. I'm good to go.
Okay.
I do get frustrated when it's not. We jump straight from a general anesthetic with our gases and our narcotics to a Tiva with no scope
No
patch.
between. Mhm.
Because for me, you could do a Tiva and I would look great all through PACU, but you would send me home, and as soon as I got in the elevator or in the car, I would be puking.
Oh,
I
I
gotcha.
totally agree with you. Like if I'm doing a Tiva on you, you're gonna have
And
scope patch
so
on.
we work with one
Yes.
anesthesiologist who is not a fan of a scope patch.
Hmm.
And so he wants to go straight to a Tiva, which is fine. I will do it, but I also want the scope patch.
Yeah.
I'm gonna be honest. I just put them on myself.
Well, I guess that's what I'm gonna have to do because if we're gonna do it, we're gonna do all the things. I guess that's where I get frustrated.
I was going to
It's-
say,
to
let's
me-
throw the kitchen sink. Let's
And if somebody
prevent
tells
the.
me that, then I do not want my patients vomiting. I think it's horrible. You've had
Oh,
surgery,
no one wants to
you're
feel bad.
hurting, and vomiting after surgery is
That's
the
the
worst
worst.
thing.
I
Because I'm
agree.
like you, I just get physically ill really easily. I get car
Yeah.
sick anyways. So I'm gonna give you all the antiemetics I can. I'm gonna put a scope patch on you. I'm gonna do a Tiva.
Mhm.
Like I even on my hysterectomies, because when you're messing with your lady bits, and they're a little bit longer, I give Benadryl because
I do too.
it's
I like
another one that
Benadryl.
helps.
And it doesn't take much, like 12.5. Is
That's
that
all
all
I
you
did.
do? Yeah.
12.5 at the beginning.
Yep.
And I think it makes all the difference.
Yeah. Not
I
all
did
50.
work. No, I did work with a girl that she, when I was in school, and she gave 50 of Benadryl to everybody. Now, their hysterectomies there took a solid 2.5 hours.
Oh.
So it had time to wear off. But if you have a quicker surgeon, then it will bite you and they will
You
not.
would be hosed. Yeah.
Can't reverse
Yeah.
that one.
Yes.
So,
Yeah.
And I can't fathom if I take 25 of Benadryl orally, like I'm out for like 2 days. So I can't
Yeah.
imagine taking
You know, and I do think that's where anesthesia is so provider specific. Like just because it works for one person and they kind of have their honed in practice and then someone else tries to do, which is why it's fun when you're a student to go try lots of different places. I do think that's one good thing. It's annoying when you're doing it, but to go and see lots of different, even just hospital to hospital, you can see big differences. But
It is one of my favorite things. Like I always tell my students, I'm like, listen, I'm going to tell you what I do, why I do it.
Yep.
That way you can piece together what anesthetic you want to do when you graduate.
Agree.
I have picked mine from people and made it mine. And as long as I have a reason for it and it works for me, then that's why I use it.
And
then
I mean, clearly mine is right.
well, yeah.
But feel free to sample the others.
and when you're with me, we're going to do it the right
Yeah,
way.
if I give
So-
a hint of I like this, that means I want you to do it.
And our students do. We have they have pearls that they send.
They
us
have
to each
notes
other,
on each of us
and it is
individually.
literally verbatim.
I
Sarah only uses Des. She does not like Steve-O. Sarah likes Steve. It's like to the dot. She wants to give this on induction, which I am like, I'll turn around. We will fix it.
Yeah. I'll
But-
keep you safe. I'll keep patients safe.
Disclaimer, we really, we do pay attention. We know what they're
Yes.
giving, but they also,
I don't want them to be like, I gave 22 mics of fentanyl instead of 25, which I would normally get. Like,
that's
okay, I need you to take a little bit of responsibility yourself and decide.
I think that's the hardest part of being a student, because you've been an ICU nurse for X amount of years. You've kind of been the top of your game there, and then you're coming back and you're feeling almost like a mother may I with everything that you're doing.
Yeah. It's a fine line.
It is.
But to be fair too, some of the preceptors require that. They're
That's
like,
true.
tell me what you're doing. And so
you tell me your plan and how much you're giving them everything, and I'll tell you if you're wrong.
Right.
Okay, at where we work now, and it's why I came back, is because I truly thought that worked best for me in a learning atmosphere.
Oh, there's been all sorts of research, because I do the students, and we've had discussions of late. There's been all sorts of research about how micromanagement and pimping are like the worst way to teach somebody. Much better is to gently guide and to give them a little taste of autonomy and figure out what works for them, especially when it comes to anesthesia, because I feel like it's such a honed craft. You can't just always do ABC, because not every patient fits that mold. So you have to start thinking to yourself, what's going to work for this patient, and how am I going to do the best anesthetic that I can for them? And you don't get that by just copying someone else. It has to come from owning it and figuring out what works for you for that patient.
in a really simple way, I put that to my students currently. I'm like, just make it make sense.
Yeah, absolutely.
But it's really like,
Yeah.
does this make sense for 97-year-old Mima? Or does this make, so.
Yeah. You're giving the same dosage that you gave to our 25-year-old male earlier. Does this make
Does
sense?
this make sense? Make it make sense.
Yeah. But my thing on pimping, and I know some people really love to do that, and I'm not judging anybody, but
I am.
I don't handle well when somebody's pimping me. And when if my mom were like, I tell every student, treat the patient like it's your mother, or if you don't like your mom, your dad, like whatever, somebody you like. And if you don't want your student to be pimped while they're intubating your mother, then you shouldn't do it to anybody else's.
No,
because it makes people shake and nervous.
I've actually reminded coworkers, if I happen to be in the room and that's happening, because sometimes I'll pop in and check in on students in different rooms or situations, or someone's decided to join us. If I feel like it's becoming a pimping and a non-beneficial growth educational moment, I will say we'll discuss this happily in just a minute when things are settled, but we're not going to do it right now. Because this is not the learning opportunity. Despite what people tell you, pimping in the middle of induction is just not the time or place.
I agree.
And I can promise you I won't remember it anyways.
Oh, I couldn't have told you my name.
Yes. Wouldn't be able to spell my last name.
No.
Right.
Don't expect me to be rattling things.
No, because right there in that moment of you pimping something that is obscure or off the wall, not related to the acute situation. Now, if you're asking them, hey, can you see the chords?
That's different.
That's totally different. Like, I need to know what you can see. But no, I could not agree more.
Yeah. Well, and also usually in that moment, the whole room is kind of stopped for a moment and looking. So it's not just, you and another or two anesthesia providers. It's circulators, it's techs, it could be a surgeon. It's a room full of people already feeling like the spotlight's on
you,
on the student. Yeah.
And I do feel like if you embarrass a student like massively in front of everyone, it will affect them the rest of the day. They will barely be functioning.
Agree.
Because they take it personally, and they're like, I've had one tell me this not too long ago. Well, I got embarrassed, and I just feel like everybody thinks I'm stupid.
And you just shut down.
Yeah, they just. And you're not going to learn anything the rest of the day if you do that.
Nope.
So.
Sarah, I feel like we're going to backstab you a minute. I need you to tell the story of as discreetly as you can about when you were a student and one of the anesthesiologists hovering and armpit sweat. And go.
Okay. So let me preface this by saying this anesthesiologist is one of the smartest human beings I've ever worked with. Plethora of knowledge, learned so much.
And not intimidating.
No.
Just his brilliance is intimidating.
Yes,
but
he was a hoverer.
Yes. So he was a hoverer. He'd be like,
and not in a bad way. He just would try to glance over your shoulder to see what you were seeing.
This is my microphone, and he would be right behind. This is my neck. And he'd be like, what do you see? What do you?
He'd be trying to peek over your shoulder.
So also his arm hair, like I could feel tickle the back of my arm when I was intubating, and I don't know why. But when he was around me and I felt like something bad was happening that I was doing, and like I was disappointing him, my left armpit would just start sweating. Just profusely. Not the right, just the left.
I just love that it's only one. Yeah, so only the left
So only
armpit.
the left armpit would sweat. I'd feel his little arm hair tickle the back of my arm when I was trying to intubate, and then just it didn't stink, so just so anybody worried,
Okay.
but it was very moist under my left side. Right side, dry as bone. So I don't know what that was about.
Maybe because that was your arm lifting. It was the arm working.
Maybe.
I guess it was
I don't know. I can relate to the unilateral sweat though, because that hair grows on more on one side than the other.
Really?
For me, that's a thing for me. Don't look at me like that.
Are we talking about your facial hair, or are we talking?
Hold on. Is it time to do a check? I don't see any patches. We're good. I haven't been at work this week, so
It's fair.
checking.
I've been checking myself. I've been more on guard. I know. No, I'm saying my armpits. Do your armpits hair grow equally?
I'm gonna say pretty.
Lacey doesn't know. Hers hasn't grown in a long time.
Yeah, I say yours is lasered off.
Listen,
You don't
it
count.
was lasered off, and then I did collagen supplements, and now I'll wake up and well, here's the thing. Like I got so used to not having to shave, and it's so sparse. But sometimes I'll wake up or I'll look down and I'm like, oh, that's like a.
Oh,
it's been a 2 months.
There's 3 hairs I can braid. I should do something about that. Yeah.
I just age, man.
Yeah.
Does numbers on you.
It's unfair that as your eyes start to go, your hair starts doing crazy things.
I know.
That was.
This is an evil trick.
It was either genius or evil, and I can't decide which one we should go with.
As you get older, you're also like, eh.
That's true.
I have definitely gotten more and more like that.
But do you know what I'm saying? You have different types of showers that you take and all the
absolutely.
Okay. That's
some are more hoe bath.
Yeah.
like you gotta do scalp stuff and hairstyle, and then you just hairless.
Yeah.
Usually after I get off call, I have to like just decon. Yes.
I hear a child.
Whose child is that?
Those guys. I know it's not mine. Mine aren't here, but that was creepy enough.
It's probably that sounds like Everly's laugh, is it?
Who's at the door?
I feel like our husbands are definitely putting them up to this.
Completely.
It's like a Darth Vader. If y'all did an egg hunt for me and you put money in it, it doesn't even have to be dollar bills, quarters, because I get really excited about quarters. It's a weird thing. I've always gotten excited about quarters. I will go hunt for them.
See, I'm more likely to hunt it if you put me one of those Reese's in it. That's the shape, because that's where it's at. I don't want the round one. No. I mean, don't get me wrong. I will eat it, but I want the shape. The football, the heart.
Are always better.
Peanut butter to chocolate ratio is different, and it's good.
I mean, I will also eat a small round one with bridges, but I would much prefer
the shape.
Any day.
I agree.
I'm so hungry right now. Oh, you know what? Who has good fries? I didn't get any last night, but Freddy's.
Oh, you like the
steak
fries?
Those are good fries.
Aren't those like the steak and shake fries?
That real like shoestring.
I hate it. You don't like those? Do you
like
like a steak, like a big?
Yeah.
You like the fat
wedge? Yeah, all the potato.
No, I want more crispy, more salt ratio.
Okay. Question, because this has been real controversial. Okay. Do you like Sonic's new fry that's the wavy or the old school?
I have no idea what you're talking about.
I didn't know that was a thing.
Well, in my little hometown, that's the only place to go get stuff. So everyone is all abuzz about Sonic.
I will sacrifice. I will take one for the team this week. I will go to Sonic and get some fries.
Please do.
That will be.
So they used to have a very similar to like McDonald's style fry. It was real good. Okay. And now they've made it like a crinkle fry. Yeah. And it has a little bit of a seasoning to it, which I do like. But it became such a different fry that it's very polarizing.
You probably like a crinkle.
I do like a crinkle. Potato. That's like Brahms.
Yeah.
No, I like them.
Give me a good crinkle.
So you like Five Guys? Don't they have steak?
No, those are thinner fries, aren't they?
Okay. I don't know.
I feel like those are thinner.
Oh,
I like a Chick-fil-A fry, the
The
waffle.
waffle.
Oh, I like
I like a good waffle.
My favorite, I wouldn't say favorite because it's not one I could eat all the time, but I do love a good Arby's curly Q seasoned,
Oh, stop it.
Yes.
right?
Those are probably
We're so
my favorite.
hungry.
Oh, I
We
know,
are
you can
hungry.
tell.
This is bad, but we're like, ooh, what kind of
Yeah.
fries?
You know what I feel like we should do? We should have episode about fries.
Oh,
We just bring them all out, taste
and try them.
and y'all can
With
watch
some
us
Diet
chew.
But
Coke.
please don't eat them before you come to surgery.
Yeah.
Back to that.
Yeah.
How this all started was we were talking about food.
I love it.
Oh, that's funny.
So don't eat, and if you do, tell us.
Just tell us.
That's the moral of today's episode. All right. Jesus wants y'all to be quiet. Bye, y'all.
Be quiet. Backstabbers out.
Bye.